diseases and how we can prevent ourselves from getting this major problem. So my plan today is to talk to you a little bit about normal heart function, and then talk to you about the grouping of cardiovascular diseases, so you can get a handle around what sort of diseases people can get with their heart. Then I'm going to try and give you a South Asian perspective of cardiovascular disease, because it is somewhat different from the perspective of non-South Asians with regards to cardiovascular disease. I'm going to talk to you about lifesavers and lifestyle and what I mean about that and what the partnership is between the two. And then I'm going to get into some new stuff, some original thinking that I have been working on, the concept of protection in nature, the program that I have developed over the years, which I have now modified, the so-called 00530 color and speed program, which is really the meat of the presentation that I want to try and get across to you. And then I'm going to talk to you about something completely new, which is the program that I am in the process of developing and haven't totally packaged it perfectly. And that's the Survival S program. This addresses your responsibility of protecting yourself and also protecting your family. So I would suggest please stay on for this last part of the program. So normal heart function, the purpose of the heart is to pump blood around the body. It starts doing that from about 5 or 6 weeks into fetal life, when the baby is still in the womb, and continues to do that essentially non-stop for 70, 80, 90 years until the patient dies. There is no other muscle or any man-made pump that I know of that can keep doing that rhythmically and absolutely non-stop for 8, 9 decades. So it's an amazing organ. So I'm going to talk to you about the physical part of the heart and its functions with the body. But then there are people who say that the heart is the seat of the soul, and it is where the love emotions emanate. And I'm not an expert at that. I may have broken a few hearts, but I certainly do not know much about spirituality and soul. Dr. Hashem or people like Jihan Baraka would be better suited to speak to you about those aspects. So the purpose of the heart is to pump blood around the body, the nutrients and the oxygen that all the organs around the body need. And the way it knows when to pump is that it has its own pacemaker, which we call the sinoatrial node, which discharges electrical current in a rhythmic manner, 60, 70, 80 times a minute. And that electrical current that is discharged from the heart's own pacemaker travels across the different chambers of the heart and allows the rhythmic contraction of the upper chambers, followed then by the lower chambers, and the blood is then pumped out into the body and into the lungs to pick up more oxygen. So the function of the heart is that it is a pump. It pumps blood around the body to deliver oxygen and nutrients. The valves allow the blood to flow only in one direction. When the blue blood or the blood with lots of carbon dioxide and waste material returns to the heart, it returns to the right side of the heart, and the right pumping chamber, which contracts in unison with the left pumping chamber, pumps the blood into the lungs, where we get rid of carbon dioxide, pick up oxygen, and it's back to the left side to be pumped around the body. So this is a continuous cycle. And for the heart to be able to do this itself, the heart muscle needs constant nutrients and constant oxygen. And that actually comes from these coronary arteries. So these coronary arteries run on the surface of the heart, and they supply blood and oxygen to the heart muscle. And there are essentially 3 coronary arteries: one that runs along the front aspect of the heart, the one that goes to the left side and the back, and one that goes to the right side of the heart. And all three arteries have multiple branches. So that is how the heart itself gets its nutrients and oxygen. So that's what happens normally when everything is fine. What happens with cardiovascular diseases? The problem arises when the heart muscle itself cannot get enough oxygen or blood. So if there is blockages in the arteries that supply blood to the heart muscle, then that area of the heart muscle does not get enough oxygen, and therefore it doesn't function properly. And if that artery was to suddenly block off with a plaque and a cholesterol deposition, and then a clot forms on it, and you get an abrupt occlusion, then you get a sudden cessation of blood supply to a particular area of the heart. Or if it happens in the brain, it's exactly the same process. Then the particular area of the brain or the particular area of the heart ends up dying. And that's what we call a heart attack or a stroke. So that's what a heart attack or a stroke is when there is sudden, abrupt cessation of blood supply to a particular part of the heart muscle or the brain, and that area dies, and that's when you get a heart attack or a stroke. Now, in the process of getting this heart attack or a stroke, that situation can set off a rhythm abnormality of the heart, and sometimes throw the rhythm of the heart completely off, and the heart begins to quiver because of the electrical activity becomes chaotic and absolutely discoordinated. And instead of the heart pumping rhythmically, it starts to just quiver, and there is no blood supply going to the brain, to the lungs, or the kidneys, or anywhere. And the patient passes out and essentially is in the process of dying. And if this is not immediately taken care of with oxygen and external cardiac massage and defibrillation electrically, then you get what we call a cardiac arrest, and the patient dies. So this cardiac arrest is not a heart attack. Cardiac arrest is an electrical malfunction of the heart where the rhythm of the heart is completely lost, and the heart is unable to get the signal how to pump, and the heart essentially stops. And that's a cardiac arrest. It's a result of a heart attack. But you can get cardiac arrest from other arrhythmia issues. So it's not always a heart attack that causes a cardiac arrest, but it's the most common cause. So sometimes you have other diseases that cause rhythm abnormalities where the heart rhythm is very slow or stops, and then we need to treat it with a pacemaker. Or some other abnormalities of the heart rhythm, such as atrial fibrillation, where you develop clots in the upper chambers of the heart, and these clots can fly off into the circulation and into the brain and end up giving you a stroke. So you can have arrhythmias that end up giving you a stroke. And then if the heart attack is large enough and damages the heart muscle significantly, then the heart muscle becomes weak. It is unable to pump the blood that is necessary to perfuse all the organs of the body. And that is what we call heart failure. Heart failure is not stopping of the heart. Heart failure is not a heart attack. Heart failure is a situation where the heart gets weak and is unable to pump the blood appropriately to all the organs of the body. And if you have a large enough heart attack, you cause significant damage, and that can lead to heart failure. But you can have other problems with the pump. You could have a valve malfunction. So the pump is not functioning efficiently. The valve is leaking or the valve is getting blocked, and you can get heart failure. That can set off an arrhythmia, and the arrhythmia could give you a stroke. So these things tend to be interconnected. And what is important to the patient is that what the patient wants, he doesn't want to die prematurely. He doesn't want his survival to be limited. And he doesn't want to have his quality of life impacted. Basically, he doesn't want to become dependent. He doesn't want to have physical disability or financial disability if he is the head of the family or something, which can have significant impact on the rest of the family members. So from a patient's perspective, when it comes to cardiovascular disease, it is all about three things. I don't want a stroke, I don't want a heart attack, and I don't want to die before my time. Okay, so you can see that the problems of the heart are essentially those of the pipes, the arteries getting blocked. So it's a plumbing problem. Or you can get a rhythm abnormality, which is an electrical problem giving you a cardiac arrest, and that's an electrical problem. Or that the pump does not function properly, is not pumping well, and you get pump failure, which is heart failure. So a good cardiologist has to be a good plumber, a good electrician, and a good pump technician. And that's when he can look after patients with all kinds of heart diseases. All right, so this hardening of the artery process that we all hear about, atherosclerosis, blockages, cholesterol deposition, all of that happens in the arteries that supply blood to the heart muscle, but it also happens in arteries that go to the brain, to the legs, and other parts of your body. And what happens over a period of years? It starts usually in childhood or adolescence, and gradually cholesterol and fibrous tissue starts to deposit on the inside lining of the artery, and the artery lumen starts to get narrower, and there is less and less blood able to flow through it into that area of the heart muscle, and then you have a problem of inadequate blood supply to the heart muscle, so that itself it cannot do its job to take care of circulation around the body. So this process starts in childhood or adolescence, progresses over years in a slow, gradual process. And when it gets to be pretty severe, then people get symptoms because there is a mismatch between the amount of blood supply needed by the heart compared to the demand that the heart has. So there's a supply and demand mismatch. And that's when we get what we call angina. So what angina is that the patient wants to do more activity, or is excited, or has some exertion or work to do. The heart therefore has to pump harder. It needs more oxygen, more nutrients, but the artery that supplies blood to that area of the heart muscle has a blockage. So there is not adequate increase in supply because of that fixed blockage. And the demand has increased, and you got an imbalance between demand and supply, and you get oxygen deficit. That oxygen deficit causes symptoms to the patient. And those symptoms of oxygen deficit to the heart are what we call angina. And angina symptoms are described very differently by different people. And it is one of the more difficult things in cardiology is to understand when the patient is talking to you, whether he or she is actually feeling angina. But there are three important characteristics of angina symptoms that you should know about. Firstly, that these symptoms come on when there's an increased demand for oxygen by the heart. So when you are exerting yourself, when you are stressed, when you're rushing, when you're excited. So these symptoms come on during that time. The second thing is that there is some kind of sensation that the patient feels in the chest, in the neck, in the arms. It could be left arm, it could be the right arm. And this is described differently by different people. They could describe it as heaviness, pressure, burning, aching feeling, squeezing. They may say they're getting breathless. And so different people describe it differently, and different cultures have different ways of explaining that. So, for example, I have this Kachi lady coming to me and he says, Dr. Saad, ke khabar hai ne anjo baji adat hai ke bau moda uthen અને પછી ઉઠે ત્યાં સુધી ત્યાં ગંધિયું ઊંધું દીવા અને મૂકે પછી રશ કરીને આખો ખટલો બનાવીને કપે ને આંજે ભાકે ગરમ ગરમ માની કપે ને પછી સીધો ચિંતો મૂકે દોડીને બ્રેકફાસ્ટ બનાવી જોવે ને મૂકે બસ સીધા છાતીમાં એવડો શ્વાસ જેવડો ઉપડી છે આંચે માં કે દુખાવો થતો હોય છે ના ના દુખાવો નતો તે પણ ગળે મેં બહુ ડૂચો ભરાવીને હતો ડૂચો. So what she is saying is that when she is trying to do 2 or 3 things at the same time and she feels rushed, that she is getting breathless and she gets a lump-like sensation in her chest, but she feels it in her throat. So that's her angina. So another lady would come to me and say, Dr. Saib, તમને ખબર છે ને બાબલાના બાપ એની બહુ આદત છે કે રોજ વોકિંગ જાય ને એ વોકિંગ જતા હોય તો બહુ જલ્દી જલ્દી જોશથી ચાલતા હોય અને હું એના સાથે ચાલું તો મને અહીંયા બસ બળતું હોય એવું બળતું થતું હોય ને એવું લાગે કે કોઈ પાટું બાંધી નાખ્યું હોય ને એવું જરા થઈ જાય. So what she's saying is she's trying to keep up with her husband who is walking fast, and she tries to do that, she feels uncomfortable. She starts to get a burning sensation in her throat, in her chest, and she feels like there is a tightening feeling, like a squeezing sensation. So that's her angina. And then, in Pakistan, I treated hundreds of patients, and they would come to me and say, Dr. Saab, जब भी मैं सीढ़ी चढ़ता हूँ उस वक्त इधर सीने में कुछ पिंचिंग जैसी होती है, पिंचिंग, और ज्यादा कोशिश करता हूं तो घबराहट हो जाती है और कि डॉक्टर साहब जो सिंकिंग फीलिंग हो रही है, सिंकिंग. So what he's telling me is that when he's rushing up the stairs, he gets this pinching, which actually is a squeezing sensation. And then if he tries to continue, he gets a little anxious and he gets this feeling that he isn't getting enough air. And then he becomes lightheaded. And he describes it as, I'm having a sinking feeling. So every person describes it differently. And it is the art of medicine that the doctor has to have to be able to understand whether the patient is describing things that mean that they're having angina, or it's something else related to gas or discomfort in the chest wall or something like that. Okay. So if you do an angiogram on a patient who is having angina, you could find something like this. This is the big front artery of the heart here, and you can clearly see that there is a significant blockage of about 75%. So this whole area of the heart, when there is increased demand, would not get enough blood. But those of you who are astute will also notice that there is a little 20-25% blockage in this artery. And what happens most of the time is that this is not the blockage that gives you a heart attack. This blockage is usually hard, it's calcified, it's been there for years and years, and it gradually keeps getting worse. And sometimes it goes on and blocks 100%. And yet the patient feels nothing, and they have an angiogram and they say, oh, doctor said one of my arteries is 100% blocked or something, because the heart compensates by forming all these little collateral or its own bypasses, and there is no damage. Heart attack only occurs when there is an abrupt cessation of blood flow. And this blockage of 20-25% is much more likely to give this patient a heart attack than this blockage. This tight blockage will give the patient angina, but this mild blockage will give the patient a heart attack. So what happens with the heart attack is you have a minor blockage, and it is the type of blockage is different from that high-grade tight blockage. The high-grade tight blockage has a lot of fibrous tissue in it. It's thick. It has a big fibrous cap. It is calcified, and it doesn't usually rupture or crack, and therefore clot does not form on it. Whereas the mild early blockages are soft, they are friable, they are cheesy, and they tend to erode and rupture, and there is blood that comes out from within the plaque, and they have a lot of cholesterol in them, and very little fibrous tissue, and a lot of inflammatory cells. So a lot of inflammation, a lot of cholesterol, friable soft plaque, which we call vulnerable plaques. They tend to form a clot immediately. And 2 minutes ago, something was 25% blocked, and now the patient has 100% abrupt blockage in that artery and is having a heart attack. And a similar thing could happen in a stroke. So that part of the heart muscle dies, or that part of the brain dies, and you end up having a heart attack or a stroke. So you can see that the high-grade tight blockages are the ones that cause symptoms. But the mild, narrower, or mild, friable, high cholesterol containing inflammatory blockages, so-called the vulnerable plaques, cause the damage, the severe heart attacks. So it is very often, in 40 to 60% of people, have this process going on inside of them, where the arteries have been accumulating cholesterol and plaque and getting narrowed, we call atherosclerosis, and they don't know anything about it. And in about 50% of people, the first thing that happens to them without any prior warning is they get a heart attack or they die suddenly. And that's the problem with this cardiovascular disease. It's going on in there. You don't know anything. There is no high-grade blockage, so you have no symptoms. And then bang, the first thing that happens is you get a heart attack or you die suddenly. So this is what happens. The heart rhythm just goes chaotic. The heart is quivering. And if you can't resuscitate that patient immediately, he ends up with flat line. And somewhere in there, Dr. Hasham or somebody will be able to explain to us that the soul leaves the body. So the heart attack symptoms are different. They do not occur with exertion or activity. They, in fact, occur most of the time when the patient is resting or after they've had physical activity, and more often in the early morning hours. So there is a circadian rhythm to when you get, more often when you get heart attacks or strokes is in the morning hours. The second thing is that the sensation they feel in the chest, neck, or arms could be very much like angina symptoms, but it could be extremely severe. And the patient could say, I feel like I have an elephant sitting on my chest. Or it could be extremely mild, and the patient could have almost minimal symptoms. But there is always something associated with their discomfort. They always seem to either sweat, have cold sweat, they get lightheaded, they feel faint, they actually pass out, they're anxious, they get fearful, they get a feeling of impending doom, they get nauseated, they throw up. So there is always something associated with the discomfort when it comes to a heart attack. And sometimes there is absolutely no symptom. And the first thing is that the patient is dead and you get immediate sudden death. So here is a patient. He was 38 years old, young male, South Asian, who had done some testing and stuff in Dubai. In Dubai, you can pay for anything and get an angiogram. So he got an angiogram and he was sent home and told everything is fine. There's nothing to worry about. He was not given any statin therapy for his cholesterol. He did not take the aspirin because somebody told him that, aspirin really doesn't work and you don't need to take it and all that kind of stuff. But he had this minor little blockage here in the big front artery of the heart. And this is what we call a widowmaker lesion. 2 months later, he presented to the emergency room of our hospital, and we were able to luckily get him into the cardiac cath lab within 30 minutes of his arrival. We had him on the table, had a catheter into his heart, and had dye injected. And you can see the whole big front artery of the heart is completely missing. There's a total blockage at that widowmaker plaque, which was just a 10% thing, is now 100% occluded. And the patient is in the process of having a massive heart attack on the front area of his heart. His electrical system could go chaotic. He could get a cardiac arrest, or if he survived, he gets a massive heart attack, damage to the heart muscle, and ends up with heart failure. Well, fortunately, we had the tertiary care cardiovascular program already running at our hospital. I was able to get a wire through the blockage, do a balloon angioplasty, and then stabilize the artery and kept it open with a stent. And this patient's life was saved. He had minimal damage to his heart muscle, and he's still doing well, alive and well. And so this is what tertiary care cardiovascular medicine and surgery is about. And this is what we developed at the Aga Khan University Hospital in Karachi. And we developed these facilities to be able to do angioplasty and stenting and open heart surgery and put in pacemakers and do special imaging with nuclear scanning and with angiography. So that was the program. I was fortunate enough to put together and be the head of that program for 4 years in Pakistan. And I was on the faculty at the Aga Khan University, and we had many patients that we treated with these procedures. So the problem with the heart attack is not only that there is often not prior warning that you just out of the blue get a heart attack. The second problem with the heart attack is that most patients die even before they get to the hospital or very soon after they get to the hospital. So this slide has a lot of information on it, but there is two simple messages. And you can see that from this image. The vast majority of people are gone and you don't even know about them with a heart attack. They die outside the hospital before they are even gotten to the hospital or before somebody even finds them, or they die early in the ambulance or on the way to the hospital. So this is a major problem with heart attacks. The second point of this slide is if you look at people who die from a heart attack. So now you're only concentrating on people who are dying from a heart attack. And you will see that almost 28% of the deaths occur within the first hour, 40% in the first 4 hours, and 50% of the deaths that occur due to a heart attack have already occurred in the first day after a patient has a heart attack. So the mortality is front-loaded, and most of it occurs before the patient reaches medical care. And this is why you don't want to get a heart attack. Even though there may be the best care available, you may not be able to reach that best care that is available. So this is Hazrat Imam's Farman in 2013. And he says, and he's concerned about these non-communicable diseases, and really carefully monitor your health because of the nature of non-communicable diseases is that it is insidious. Insidious means you are unaware of it. It's going on inside. It's progressive, so it going to continue. And it has a sinister problem with it that when it does rear its ugly head, it's already too late and bang, you have a heart attack or a stroke. So that's the problem with non-communicable cardiovascular diseases. And Hazrat Imam uses the word insidious, which has all this connotation to it. And he says it's different from communicable diseases like COVID or other virus infections and stuff. And therefore, he says, I urge you vigorously, regularly to have checkups so that you can be detected to see if you're already at risk or already having this cardiovascular problem. So let's move on to the South Asian perspective. And what is the South Asian perspective of cardiac disease? South Asians are people who have their ancestry in these countries: Pakistan, India, Sri Lanka, Nepal, Bhutan, Bangladesh, Burma, which is Myanmar. So if you have your ancestry from those countries, you are termed genetically to be South Asian. Even though you may be a third generation Canadian or a fifth generation British or Californian or whatever, but if your ancestry is from there, you have this South Asian genetic cardiovascular problem. And if you look at the rural areas of South Asia, 3% of people have significant coronary heart disease. That's a pretty reasonably high number. And that is the baseline underlying genetic risk. But when South Asians move to the cities, they urbanize, they pick up Western lifestyle, the rate of heart disease jumps up 3 to 4-fold and becomes 10% or 12%. So there is this effect of genetics. And on top of it, there is this effect of lifestyle changes, which cause the disease to become rampant. So what's the next thing about South Asians? Well, South Asians just want to migrate out of South Asia. It's for 2 or 3 centuries. That's what everybody in those countries wants to do, is just go off to Australia or England or America or somewhere. So we have migrated all across the world from there, East Africa, South Africa. And if you look at South Asians all across the world, we form about 25% of the global population. And yet, we carry 60% of the global burden of cardiovascular disease. Disproportionately higher amount of cardiovascular disease occurs in South Asian people. So when we migrate to those countries, we bring with us this higher risk of 10 or 12% into these North American countries or Europe. And we have a much higher prevalence of this disease compared to the general population or other ethnic groups. And within about 10 years, when we then pick up the further bad cultural habits of Western society, we add to this risk. And within 10 years of migration, the South Asian first generation and second generation gets a worse prevalence of cardiovascular disease than they already came with from East Africa or from Pakistan or wherever. What's the next thing about South Asians that's worrisome? If you look at South Asians who get a heart attack, so you say to yourself, what age did this South Asian person get a heart attack? And what you find is that 50% of the heart attacks in South Asian occur under the age of 50. Just think about it. Half the heart attacks in South Asians occur before they even get to the age of 50. It's a big problem. We get it at a younger age. So if you look at non-South Asians, 50% of them get a heart attack by the age of 65. So we get our heart attack earlier compared to non-South Asians. And this last evidence slide I'm going to show you is going to really hit home the message. This is a National Institute of Health done study in California. So this is a very valid, high-level study where they looked at different ethnic groups in California, and they looked at the mortality rate from cardiovascular disease. So those who actually died. So there was no ambiguity here. We were looking at hard endpoints. And if you look, the way this is this is a ratio, normalized ratio. So if you are on the line of 100, that's what the average ratio of death rate is due to cardiovascular disease. And you will see that certain populations, Japanese and Chinese, actually have a lower death rate from cardiovascular disease than others. And the whites are usually around this 100% mark. But you look at the red, the Indians, the South Asians, at every age group, in the older age group, we die 1.5 times more with the same disease. In middle age, we die twice as more. And look at these young South Asian males. They get a heart attack, they are 3 times as likely to die. A complete paradox of anything that you would think of in medicine. The younger male, quote unquote, healthy, gets a heart attack and he dies. So this is the South Asian paradox of cardiovascular disease that we have to be very aware of. So let's say you get your heart attack and you survive. What happens after that? This line is the line of normal people. As we age, we die. So there is an attrition over a period of time. But people who have had a cardiovascular problem tend to die more. So they have diminished survival. These are the whites. But look at Indians and Pakistanis. They have a much more decreased survival compared to whites, compared to normal. And so even if we survive the heart attack, our survival beyond that, despite getting the treatment, is not as good as other people who are non-South Asian. So lifestyle plays a very significant role over and above the genetic risk that we carry. More South Asians get coronary diseases compared to non-South Asians, particularly the migration effect. South Asians get the disease earlier in life compared to non-South Asians. South Asians with coronary disease have a worse survival, particularly the younger they are when they get the thing. So what happens with South Asians is this aging process of the arteries. As we age, we get older, the arteries get hardening and they get blockages and so this is an aging process. In South Asians, related to our risk factors and our genetics, our arteries age faster than others. So our arteries are 60 years old when we are 50 years old. And that's why we get into more trouble. So this was the rationale behind developing cardiovascular programs as the first tertiary care programs at our Aga Khan University Hospital in Karachi, and then subsequently at the Aga Khan University Hospital in Nairobi. And at that time of the opening, I was supposed to, show Hazrat Imam the equipment and the patient that we had done the day before. And I didn't know that he was going to quiz me and interview me in front of all the dignitaries, and Pakistan television was live at that point. And he started to ask me about why did we develop a cardiovascular tertiary program in a third world country when we are dealing with infections and malnutrition and all these other factors. And I had to explain, and it was probably for the benefit of the media and others that he was asking me these questions. He wanted to know, why did we develop this program and not some other program? How is this program developed? What is this program going to actually do, and what services it's going to provide? What quality measures are you going to be putting in place, and how are you going to know that the quality of care that you are giving here at our hospital is going to be as good as any hospital in North America or UK? And I had to explain to him how we were prospectively going to collect data and do that. It was probably the toughest interview I've had in my life, the time that I was absolutely in panic mode. And I did not actually even know half the time what I was saying, because it was extremely stressful. But I think I got all the points across that we had to make. And hopefully, if we have time in the question and answer period, I'll tell you a little Mola Bapa story about this first patient that I did at AKU, and it will be interesting to you. I was fortunate enough also to be involved in the planning of the cardiovascular program in East Africa at the Nairobi Hospital. I developed the strategic plan for the implementation and authored the strategic plan document in 2002, and the program subsequently opened in 2008 with cardiovascular and cancer oncology as well. So this is what Hazrat Imam has said, that in our own institutions, we are concentrating in all our medical programs on non-communicable disease, on cardiology, in oncology, neurosciences. So he's talking about the fact that our institutions have to be properly prepared to handle non-communicable diseases. And what else? He wants those facilities to be developed where the Jamaat is living so that they can access good healthcare. People in East Africa don't have to rush off to India, to UK or South Africa to get their care. And people in Pakistan and Afghanistan can get their care at AKU, which is equivalent to the care any other place in the world, and don't have to be subjected to subpar cardiovascular care. So those were his thoughts upon which these programs were developed. And he goes on to say in this Farban in the General Didar in Nairobi, my Jamaat should simply know that new knowledge and new competencies are going to have to be developed to ensure that my murids live as long as Allah will give them their lives. What he's talking about here is the concept of premature death, that you do not want these diseases to take you away before your time. Allah has given you a certain lifespan, but when you live the wrong way and you develop these non-communicable diseases, you're going to be subjecting yourself to the risk of poor survival, premature death. And then he goes on to emphasize it is that as a Jamaat, we are not. He's saying that Jamaat is not aware of these very, very risky trends for you and your family. And we are becoming more and more aware. And these talks are helping bring this awareness to our Jamaat. So this process is partly genetic, partly related to risk factors, and the two interact together. And when you have these risk factors, then you tend to age your arteries faster than your own age, and they tend to get blockages. So the South Asian problem is that our risk factor profile that causes our cardiovascular problem is a little bit different. We have a different genetic predisposition, a stronger genetic predisposition, and there are 4 factors that are genetic that play a role in South Asians, and we have a different metabolism. And our metabolism interacts with our genetics and our lifestyle and causes this severe blockages in the arteries of the heart, causing a trouble. So it is a dual problem. And therefore, our risk factor profile is different from those of non-South Asians. And the key thing I want you to take away from this is that our cardiovascular disease and blockages runs through the process of sugar, runs through sugar and insulin. And it is through this carbohydrate pathway where starch makes sugar, you eat sugar, you make more glucose, there's excess insulin, insulin damages the heart arteries, and you get this trouble. So we have a different pathway that leads to these very vulnerable plaques in our arteries that are easy to rupture and clot and cause heart attacks. So our genetics is bad, genetics loads the gun, and our lifestyle is terrible, and the risk factors end up pulling the trigger for this fatal disease in South Asians. So I'm going to now change gears and talk to you about the positive things now. We're moving away from negative and moving into the positive world of cardiovascular disease. And I want to talk to you about what you can do and the concept of lifestyle and lifesavers. So lifesaver starts with your cardiologist or your physician. He has to know his job right. He has to do his job properly, diagnose it properly, pick the right medications, provide you the right treatment, do the procedures properly. And so he is part of the lifesavers. But in addition to him, it is the medications that he uses, the possibility and the capabilities to do the angioplasty and stenting, do open heart surgery, do insertion of pacemakers. So these together are all the lifesavers that have helped patients not get disabled or die from their cardiovascular disease. But there is this concept of lifestyle, and I've tried to explain to you that this disease occurs due to a combination of your genetics and the bad lifestyle that you live. And lifestyle issues are the total responsibility of the patient. The physician or the nutritionist or whoever can give you recommendations, but it is the patient's responsibility to follow the appropriate recommendations and alter their lifestyle. It is the cardiologist's responsibility to provide the proper life savers. So it is a dual process. the patient has to alter his lifestyle in a proper way with his diet and activity and overweight and smoking. All of these are lifestyle issues that, if not well controlled, leads to high blood pressure, diabetes, cholesterol trouble, and then on to heart attack, strokes, and premature death. So if you look at what has happened in the last 20, 30 years in these well-developed countries, there is actually a drop in mortality from cardiovascular disease, particularly in the last 20, 30 years, beginning in the 1970s. And why are we now having better survival, even though people are having cardiovascular disease? And this issue has been analyzed by multiple studies, and this is just one of them done in England and Wales. And what it showed that over a period of 20 years, there were close to 70,000 fewer deaths that occurred from cardiovascular disease than would have occurred in the previous 20 years. And they analyzed as to what was the reason for this improved survival. And like many other studies, they showed essentially the same thing, that 50% of this improvement in survival is because of the lifesavers, the treatments that the patients receive, and the doctors who have the knowledge. And 50% of it is related to control of risk factors and improvement in lifestyle by the patient, who then agrees to take the statin or the blood pressure pill to control his cholesterol and his blood pressure and leads a better lifestyle. And so both play a significant role, almost equal role, in decreasing this mortality. But the problem arises when you get sugar involved in the system of your metabolism, and you have more of a diabetic tendency, and you become more overweight, particularly around the belly, that these people are actually dying more now than they used to. So we are in trouble with those people, and we are losing some of our gains. So it's a combined responsibility. The doctor has to do his part right, and the patient is not going to be happy if the doctor gives wrong medications or messes up with the procedure. In the same way, the patient has his responsibility to follow the lifestyle measures perfectly and appropriately. And if he doesn't do that, the outcome's not going to be good. But when both sides do their job right, you get successful, excellent outcome in patients who have cardiovascular disease because of the knowledge and skills and the medications we have now. So back to Hazrat Imam's Farman, and this is the second Farman that Hazrat Imam made officially to the Jamaat directly. So Hazrat Imam, became Imam in July, and then, he sent sandeshas and messages and sort of Farmans. But his first visit was to Kenya. And he came to Kenya for the Taknashini, but first went to Mombasa, and he made a series of Farmans. And this is part of the second Farman he made. And in the first 7 Farmans he made in Mombasa, and then in the 7th one in Nairobi, 4 of them had to do with health issues. Look it up, you will see. So this is the very second Farman that Hazrat Imam made when he became an Imam. He said, if the doctor tells you to take a pill at 4 o'clock, he doesn't mean 5. He doesn't mean 3:30. He means 4 o'clock. So he's trying to explain to you to follow the doctor's instructions properly. If he tells you not to eat a certain food, do not eat it. You must understand that. So he's talking about the concept of adherence, that you have a responsibility. You have to follow what is being given to you, medications or advice, if you are going to stay well. So now I'm going to move into a completely new thought process, which is a process that I have been working on and developing, which is called the concept of protection in nature. So what do I mean by that? So let's go back to the Quran. So the Quran says in this ayat, O mankind, fear your Lord, who created you from one single soul, and out of it created its mate, and out of the two spread many men and women. So we all know about a single soul, and we are one people, and we are all the same, and all that stuff that Hazrat Imam talked about in the parliamentary address in Canada. But there is this other part of this ayat, and he says, out of that single soul, out of it created its mate, your partner, your person who loves and protects and supports you, is there for you when you are facing challenges, is there for you to celebrate your victories. And out of the two are spread many men and women, that you have groups and you have families and you have community. And that is protection that's created. Why do I say that? This is a Harvard University study which has been going on for 80 years, where they have followed Harvard University graduates as they went through middle age and old age to see who were the ones who actually survived, who were healthy at, at that time of survival, and who were the ones who died sooner or developed health problems. So this study was about physical issues. But lo and behold, what they found was completely different. So here is one of the things they found. They found that mates, so we're talking about your partner, that if there is a most satisfied relationship between the two at the age of 80, these couples lived to long life into their 80s and were healthy. They didn't just survive till that age, they survived in a healthy mode. So it is something about this relationship, support system, love, caring, compassion that breeds health, good health. And so the study, when it began, nobody thought about empathy or attachment. But as the study went along, it became very clear that it is all about relationships, relationships, and relationships. Your groups, your families, your community. And they found that people who were lonely became depressed, and their risk factor of developing cardiovascular disease or dying was just as powerful as smoking or alcoholism. So you can see that the protection in nature of having your mate, developing communities, having groups, and the interaction amongst each other is a protection system that Allah has put in our lives, which we have to utilize to the fullest in order to protect ourselves. Okay, so what's the other? Sorry, just to go back to Hazrat Imam's Farman, we've all heard this Farman from Golden Jubilee that Hazrat Imam made in Lisbon. And basically, he's talking about the Olympics games and somebody wins, and he's not going to get up and say bravo steroids, because he may have been cheating and he got the 100 meters race because he had additional help from steroids. But broccoli can do the same thing, and nobody's going to stand up and say bravo broccoli. So he's contrasting good to bad protection and good things that help you health-wise, and bad things that make you look like you're healthier, but they are not actually doing the job. So he's contrasting and he's balancing something. And then he talks about, so he laughs about this bravo broccoli, and he talks about happiness and about laughing, and that we are a religion of happiness. So he's bringing this concept of how being happy and laughing actually is protective to you in terms of your physical health, not just mental health. And so he goes on to then say, you're going to have dandiya ras, and you're going to eat all sorts of things, samosas and biryani and stuff. And I hope no broccoli turns up. So now he's telling you something different. Broccoli is protective, it's good. Samosas and biryani are bad, but he says, enjoy the samosas and the biryani because you're celebrating, you're happy, you're playing dandiya ras, and laugh, because that happiness and that laughter is going to counteract any negative that is going to be in the samosa and the biryani. And you don't need to bring broccoli into the equation at that time. So he's talking about this balance issue and the contrast and the impact your mind and happiness has on your physical life. So I've always used this in my practice with my patients. I try to judge them and explain to them about happiness index of 0 to 10. And it is their personal responsibility to make the efforts to make themselves be happy. And it requires gratitude and love. And if you're bitter and negative, you're going to pull yourself down the happiness index scale and talk to them about the relationship index, loneliness at one hand, friends, groups, and families at the other end. So let's move on to the next protection issue that is there in nature, and that is about activity. Activity is not just something that help you such that it is not harmful to you, but it actually is protection for you from the other risks that may be there that are going to give you cardiovascular disease. So hear me out. So this is a study of over 13,000 healthy people. So they didn't have any diseases. And they looked at who was physically fit. And what they found, that people who were very physically fit actually had the lowest death rate when they were followed for 8 years. Whereas people who were unfit, even though they were quote unquote healthy, that didn't have any diseases, they ended up dying much more than the people who were physically fit. So physical fitness, activity in itself is protective. It has this protection built in from dying. So here is a situation that's a little different. People have diseases. So let's look at diabetes. So people who have diabetes tend to have a higher risk of developing cardiovascular disease and cardiovascular death. But if you look at all diabetic patients and you look at those who are poor fitness, they're not doing much activity, they are not physically fit, versus diabetics who are physically fit. So even though all of them have diabetics, those who are not physically fit and to have a higher death rate, and those who are physically fit, even though they have diabetes, the physical fitness protects them from dying from their diabetes. So activity is a protective phenomenon. And there is a big experiment of nature going on in East Africa at the present time. The Maasai eat meat all the time. They drink milk and blood, and their diet would be considered atrocious for cardiovascular disease. But they don't get it. Why? Because they are constantly in motion. They're constantly moving, and they're constantly doing activity. And the day the Maasai start riding motorcycles, eating hamburgers, or smoking, they are going to be wiped out in 1 or 2 generations from cardiovascular disease. So it is the activity that is in protection. So this experiment is going on, and we will see the results in a few years because lots of scientists are following and tracking this phenomenon in the Maasai tribes in East Africa. So what is the third protection system that is present in nature? And that's the protection system in foods. There are lots of foods that you eat that can harm your health. And most of these are not foods that are in their natural state. These are foods that we process, that we package, that we alter, we adulterate, and then we eat those foods and we get cardiovascular problems. For example, we can eat lean meat or chicken, and it is not going to harm you so much. But then if you make sausage out of it, beef sausage or chicken sausage, and it's combined with all the other things that are mixed in, and the preservatives and the adulteration of the molecules of carbohydrate and protein, it becomes harmful to you. So when we adulterate food, process it, they increase the harmness of that food. So fresh fruits and vegetables have protection built into them. They have phytochemicals, they have antioxidants of the type that can go into your body and actually protect you from getting hardening of the arteries and blockages. So if you eat lots of fruits and vegetables, you have much less risk of cardiovascular disease. Then there is legumes and grains and all the dals and the mung and all that stuff. And if you eat a lot of that, it has protection built into it. And I'll tell you where we lose the protection with how we cook these foods. So if you eat lots of legumes and grains, you get less cardiovascular death rate. So these are protective things in nature, fruits and vegetables, and legumes and grains, which tend to provide protection against the harmful things that you do, because we all transgress. And when you eat that biryani and stuff, the salad, a bowl of salad, and a fresh fruit for dessert, even though you eat more, is going to be less harmful than just eating that plate of biryani. So here is this Interheart study, which looked at people who had the first heart attack in hospital, and they compared them to people who were in hospital at the same time who did not have a heart attack. And they found that the people who had heart attacks were smoking more, they had more diabetes, more hypertension, they were overweight, they were under more stress, they had more bad cholesterol, and all that stuff. But what was the new finding in that study, which was done in the 70s and 80s, was that those who ate a lot of fruits and vegetables and who were physically active had actually protection from getting a heart attack. And look at these people who exercised regularly and ate fruits, they had about a 50% decrease in the chance of getting a heart attack. So that's the protection that's built into the system. So this is what is there. So how do you know and how to choose foods that are protective to you and that are going to be healthy, and which ones to avoid? And that's the program I've developed, which is called the 00530 program. And I have now modified it to be the 00530 Color and Speed program. So what is this program? So 0 for smoking. You should smoke, not smoke at all, never start. If you are smoking, you should quit. 0 alcohol would be ideal as far as I'm concerned. And someday, hopefully, I'll get the opportunity to talk to you about alcohol and health. And there is absolutely nothing protective about alcohol or wine that is factual. And so as little as possible or none. And 5, at least 5 servings of fruit and vegetables every day. 1 serving is what you can hold in your fist. So you want to have at least 5 servings of fruits and vegetables per day, and at least 30 minutes of activity per day. It doesn't matter what activity or exercise or what you don't have to go to the gym, and you don't have to do it all 30 minutes at one time. You can do it in 10, 15-minute aliquots and get the same benefit. Somebody is making marks on my slides. I don't know where from, but anyway. So this is Hazimam's Farman. So he said that I always have one principle which you all should follow. That is, a little bit of exercise every day is the best thing to improve the quality of one's work, rest your mind, and be fit for the next day. So he's talking about regular little bit of exercise on an everyday basis. And we have now found scientific evidence that that is all that is needed, is that 20 to 30 minutes of activity on a daily basis. So that's 0 smoking, 0 alcohol if possible, 5 servings of fruits and vegetables per day, 30 minutes of activity. So if you eat a large bowl of salad with your meal, that's already 2 or 3 or so servings of vegetables. And then you eat a fruit salad after that, or you eat an apple with your breakfast, or you eat some mixed fruit with a little bit of yogurt ice cream after dinner. Then you've got your 5 or more servings of fruits and vegetables. It's not difficult at all. So what is this color and speed thing? All right. So color and speed helps you pick the foods correctly. So about color. So when it comes to color, we are talking about foods that are not meats. They are not poultry. They are not seafood. That's a different category. So we're talking about vegetables, fruits, legumes, nuts, and you look at the color. The more colorful the fruit or vegetable is, or darker the grain is, or the legume, more protection is built into that. So Allah has done it for you. He says, look, I have put protection out there, and just so that you don't miss it, and just so that you can be anywhere in the world, of any culture, of any education level or any age, you can prick it out. Anything that's very colorful is got protection in it. Anything that's darker has got protection in it. And everything that's lighter is going to harm you, lighter in color. So, the white foods, rice, bread, potatoes, pasta, noodles, they all have empty starch in it. And they cause you to develop extra sugar in your blood. And that's what ends up giving you trouble. So you have to avoid the foods that are pale, that are lighter in color. And then if you ask me, well, are peanuts better or walnuts better? Well, I say to you, look at it. Walnuts are darker, peanuts are lighter, the walnuts are better. So it's just as easy as that. And the protection is out there for you to see, and it is colorful. So here is the superest of superest fruit, pomegranate. And it has a lot of color in it. So much color that you can't eat pomegranate without getting the redness in your fingertips and in your lips and on your teeth and possibly even on your shirt. So there is so much protection, and it's in the color that tells you that. Here is the superest of vegetables, beets. I mean, you can make borscht, or you can make beet soup, or you can have beets with your salad. And then next day, when you go to the washroom and pass urine, I guarantee you it's going to be reddish or reddish color in the urine, because there is so much protection in the beets. It overflows out and it's then excreted in your urine in the kidney the next day. So it's very easy to know the protection. So what is bad? Anything white is bad. And of all the things for South Asians that can be bad is sugar. And I don't mean sugar directly, sugar, the white sugar that you put in your tea, or the brown sugar or whatever. That is sucrose. You make two molecules of glucose in your body, and it's the glucose that's the problem of the metabolism. But sugar is there in many other things. It's in the beverages that you drink, the sugar sweetened beverages, which I call WMD, weapons of mass destruction. The grain desserts, the baked goods, they have a lot of sugar in them. Fruit drinks, desserts made out of dairy. Milk and buttermilk is good for you. It does not harm you. But when you take the dairy and make desserts and creams and adulterate it, it harms you. Candy, sweets. So you can get sugar in many different ways, and you have to be very careful. And so you want to avoid the foods that are white, the sugar containing foods, and the starch, the empty calories. Rice, bread, potatoes, pasta, noodles. Rice, bread, potatoes, pasta, noodles. Because one molecule of starch makes 6 molecules of glucose when it is digested in your body. And that's where you get the overload of sugar into your system. And that sets off the whole negative metabolism in the South Asians, and your arteries start to get damaged and you get blockages. The other thing that is poison, absolute poison for the arteries, for all people, but particularly for South Asian people, is oil. When you fry the food, when you deep fry foods, doesn't matter what oil it is, it just causes extreme harm. And it is like acid, the pouring acid inside your arteries, damaging the lining of your arteries. So frying food, oil, is a particularly bad thing that you have to avoid. So what about eggs? People talk about eggs, and there has been lots of controversy back and forth. Eggs are good, not good. And during the question and answer period, I can explain to you about, these new changes in dietary instructions, whether, you can take cholesterol in your diet and it's not harmful. And maybe we can go into that, but just deal with the issue of eggs. we have now multiple studies that have shown that higher consumption of eggs, even up to 1 egg per day, so we're talking about 7 eggs a week, is not associated with increased risk of coronary heart disease. It's when you fry the eggs in oil. That's what harms you. It's not the egg. Egg has a lot of nutrients and protection in it that is healthy. But when you adulterate the egg by frying it, that's when you get into trouble. So, my wife, she's she's a very, very special lady. I call her Kia Pop. Kia Pop stands for she is Miss Know It All, Princess of Perfection. So I can never really argue with her. But anyway, she comes up with these new ways of feeding me eggs, which are healthy. So she has this little dishes where she puts the egg in them, punches the yolk, and puts a half a teaspoon of water there, and salt and pepper and stuff. And I like a little red chilies. And she pops it into the microwave for 1 minute, brings it out, and I get a delicious egg, much better than Sunny Side or Over Easy or anything like that, and absolutely no oil in it. So you can eat boiled eggs, or you can eat poached eggs, or you can eat eggs the way that I just described to you. So this is Sultan Muhammad Shah's message and farman from 1945. He's talking about eating meat as little as possible, and we're going to get to that in a minute. But so he's implying more fish and more poultry. And he says to you, learn how to cook it, the meat. So it is when you cook it with oil, like we make the curries, or we fry the meat, or the chicken, or fried chicken, or Kentucky Fried, or whatever that stuff is what harms you. So you got to learn to cook your meats, to grill them, to barbecue them, to bake them, to saute them, so that you do not lose the protection that is in the food. And he's talking about eating a lot of fish, and fresh eggs are beneficial. He's already said it in 1945. Science is just coming around now to let us know. And he's saying about, to have milk, yogurt, buttermilk, cheese, not the processed old cheese, but the regular simple cheese that you even make at home. Those are protective. He's talking about fresh fruits and vegetables, and he's talking about salt in the elderly. So we have been given these gems of healthy living for years and years ago. So what about oils? We are going to have to use some oils. So there are some oils that are there in nature that have protection built into them. Not only do they not harm you, they actually protect you. So eating olives or using olive oil is actually protective. Canola oil is maybe partly protective, and there is good scientific data that it is. This is the oil that's developed in Canada. It's a rapeseed oil. This was first built, the seed was first developed at the University of Manitoba, and that's why it's called canola oil, because this is Canada oil. And it's all over the world now. And avocado is a protective fat. Nuts have protective oils in them. The second next best are the polyunsaturated vegetable oils. And the worst are your animal fat oils or your tropical oils. They are most harmful. So that's about 00530 color and how to pick those foods. What about speed? What do I mean by speed? Speed relates to meats. So whether it is land meats, poultry, whether it is seafood, shellfish, this is where speed comes into play. And what do I mean? So if you eat chicken, meat, or if you eat lamb, which is going to be more harmful? How do you know? You don't have to go to nutrition classes. You don't have to read labels. You don't have to pay $200 to join any program. You just have to think, okay, I'm eating lamb, I'm eating chicken. Which one of these, when it was alive, moved faster? So the chicken flies faster than the lamb can walk or run. So anything that flies or moves, swims, or runs faster is a healthier meat. And anything that is sluggish or slower is going to be more unhealthy. So that's it. You just have to think of what you're eating. And what did that animal, bird, or fish do when it was alive? How fast did it move, or how slow did it move? So the pig, which just sits around all day long and does very little activity, has the most harmful meat. Deer, which is running all the time and jumping around, is lean. The meat is the best. And it goes in a gradation. So when you look at seafood, the fish that swim on the surface are the fast swimming fishes, right? And that's salmon and trout and sea bass and tuna and tilapia, herring, sardines. Those are fish that have oil in them, omega-3 oil. It's packaged in a particular way in that fish that when you eat the fish, it goes into your body and provides you protection against heart disease. But if you take omega-3 or omega-3/6 capsules, you get zero protection, absolutely zero protection. And we can discuss this further in the question and answer session. So you look at bottom feeders, the fish that are at the bottom and swim at the bottom of the lake or ocean. And these are the slow swimming fishes, whitefish, cod, haddock. They are not as healthy. And then you look at things that are very sluggish in terms of seafood. Prawns, they swim very little. Lobsters, some actually just stuck to the rock, mussels and scallops. They are the least healthy and they don't have much protection built into them. So it's all about speed. When you're eating meats, poultry, or seafood, just think of how fast that thing moved when it was alive, and you will know whether it's healthy or not. So it's all about 00530, color and speed. And if you just follow this, you've got 80% of diet completely covered, and you will be more healthy than going to any diet class or joining any diet program or anything of that kind or reading labels. So how true is this, my program? Is there proof of my program? Well, over the years, I've been teaching it. And then recently in 2018, they presented what was called the PURE study, where over 200,000 patients from over 50 countries were followed. And they looked at their diets and activity and looked at who died more and who survived more based on their diet and on their activity. Well, lo and behold, they found that the people who died more ate this unhealthy food. White stuff, rice, bread, potatoes, pasta, noodles, white, flour with syrup, sugar, fried, chips, deep fried. They've got trans fats in it. They've adulterated the oil, sugars with desserts and creams, adulterated milk, sugar, sugary drinks. These people who took these foods and drinks tended to die more. And look at what was supposed to be healthy. Look at this slide. You think that they actually stole my program and stole my slides. Fruits and vegetables, dark colored legumes, milk and buttermilk, fresh dairy, eggs, fish that swim fast, lean meat that runs faster, goat, deer, not pig, not lamb. So they looked at that. And here's the proof. Total mortality was much lower in people who followed the program like 00530, color and speed. And they found that the people, in terms of activity, the best survival was people who did just about 150 minutes of physical activity in a week. So that's 30 minutes 5 times a week. Well, I say 30 minutes, 7 days a week. While you tell a kid that you're supposed to brush your teeth 5 days a week, and you look at him when he's 15 or 20 years old, I bet you he's not going to be brushing teeth very regularly. But kids who are taught to brush teeth every day, or when they're 15, 20, 30, or whatever age, they'll be brushing their teeth every day. So I say 30 minutes daily, and that's what Hazriman Farman said right at the beginning that I showed you previously. So they concluded that diets that comprised with lots of fruits, vegetables, legumes, fish, dairy, and meats had a lower mortality, but you have to know how to choose your meats. So here's Hazriman Farman from 1957. This was a Farman he sent by tape. So this is probably the first start of virtual Farmans or virtual didars from Hazrimam, where he did not physically come. That was just before he came for his Taknashini to Kenya. And he says, I'm sending you this thing by electromagnetic tape recording machine, but I want you to listen to it just as if I'm standing here and speaking to you in this room. He's emphasizing the importance of what he's going to tell you. Like I am telling you, he says, like I'm standing in front of you. And he talks about, again, too many sweets are bad for your teeth. Bad teeth, which are not cleaned regularly, can lead to much more serious diseases. What is he saying? It's not about decay of your teeth only or getting gum disease. He's talking about much more serious diseases. What is it? Here is research from 2005, published by the American Heart Association, clearly showing recent research indicates that periodontitis, which is gum disease due to poor dental hygiene, is associated with the development of cardiovascular disease. He says much more serious diseases in the future. There is now data from research which shows that bad teeth and poor gum disease and poor dental hygiene is associated with dementia as well. So there are some things that we are taught and told, and we don't understand the importance of it at that time. And then science comes along decades later, and we understand the value of that. Well, this is the last phase, the newest of the programs that I'm developing, which I call the Survival S program for successful long-term survival, healthy and happy. And I'm talking about your responsibility to protect yourself and your family. So this program works best if you start early in life. Earlier the better. Habits are easier to put into action in younger age groups. And you need to make relatively small changes in lifestyle to get large benefits down the road. And children are flexible and adaptable. And you don't miss something if you've never actually had it. So I've never had pork or ham, so I don't miss it, right? So it is bad for my health, but I don't have to worry about it because I never ate it. So Gamfin, I am not going to eat it. So what did Hazimam say in his third farman? His third farman, when he became imam, physically in front of the Jamaat. Concerning your health, doctor says if you have to eat this food, you shouldn't take your pill at the right time or that. But look what he goes on to say. You must not forget that you are responsible for your children and for your parents. And you are not free to endanger your lives just so that because you do not wish to follow doctor's orders. Because when you don't show responsibility to your own health, it's going to impact your children and your parents. As if that was not enough, on the very same day in the next farman, he says it again. You must also consider that you have children and parents and that you are responsible for. By endangering your own health, you're endangering their lives, and of course, you cannot work. So he's implying disability, not just physically, but economical and financial disability, which will impact your life and your family. So what is my newest primordial prevention program, which helps you not get the risk factors in the first place, so you don't have to then worry about cholesterol or blood pressure or anything. So this is what I call the S, successful survival program, a long, healthy, and a good quality of life without disability or depression. So you've got to master this letter S for success. So what do I mean by that? So S for stress. Stress is harmful. And what kinds of stress are harmful? Stress where there is competition between middle management people at work. They are not union people, they are not bosses who can make their own decisions, but they are middle management. They have to compete with each other. And there is performance output that decides your promotion and things. And stress that is emotional, when there is pain involved with your stress. So I love doing these presentations. It's a lot of work. I put it together, I give this presentation, and people would say, I'm stressed. I'm not. I am actually enjoying it. And this thing, this stress, is completely not harmful. But when you get into a problem with your spouse or with your children, that same stress you could have gotten into with someone that is unrelated to you. But when it happens with someone you love, that pain and that stress becomes harmful to you. So when there is emotion involved in the stress, that's when you are in trouble. What is the other S? Silence. What do I mean by silence? I mean silence of the mind. Not about silence from speaking, but learn to silence your mind. And you could do it in a spiritual way and do it in a formal meditation manner, or you could do it by being close to nature and being by yourself and giving your mind a rest. And that is highly protective. Sleep, the other S. What do I mean? You need at least 7 hours of sleep to remain healthy. And the problem is when you sleep. It's not just the amount of sleep, but when you sleep. If you go to bed at midnight and you wake up at 7 a.m., yes, you've had 7 hours of sleep. It is not healthy. But if you went to bed at 10 p.m. and you got up at 5 a.m., you got 7 hours of sleep. But this is highly healthy and refreshes your hormonal system, your metabolic system, your mind, and you are much more effective with your mind and your body throughout that day. So it is the quality of sleeps. And I'll explain to you about how to do that at a later slide. And people say, well, I go to bed and I can't fall asleep at 10 o'clock. I have to watch the news, this and that. So I might as well finish it right now. And so they say, I toss and turn and I can't go to sleep. So this doesn't work for me. Why tell them, don't worry. Just listen to your news, go to bed whenever you want to go to bed, 11, 12, I don't care. But the next morning, set up your system that you wake up 1 hour early. So if you're getting up at 8 or 9, just get up at 7 or 8. So start getting up earlier. So as the day goes on, you don't go back to sleep in the afternoon or anything. And as the evening comes, you will start getting tired earlier. And as you work yourself up to 5 a.m., I guarantee you, after a few weeks, a month or two, you will want to go to bed by 10 o'clock. So start not at going to bed early, but start at waking up earlier. And then you will be able to fall asleep earlier. Social. I told you about the Harvard University study. It is all about relationships. Don't break relationships with people. Somebody, upset you or said something. Well, get over it. Give him a break. You are not perfect. You do things that people are upset about, but that's no reason to break friendships or relationships. Be part of groups, be part of a community, avoid being alone. So loneliness is a big thing. And I talked to you about happiness index and gratitude and love. So social. Well, what about food, diet? So all I'm going to tell you in this slide is what to do, how to eat, and when to eat. And it doesn't matter what you eat. So in this slide, you don't have to make any change in your diet at all, but you make changes in how you eat and when you eat. So when you eat slowly, and there's a lot of science behind it, that you end up not getting the harmful effects of food, overeating, and you don't get the harmful effects of insulin and the insulin surge and many of the problems that arise from eating. And so there are two ways that I find are very effective. You know what we do most of the time? We eat with a spoon rice and curry or whatever, with fork and knife, a steak and potatoes and stuff. And you see what, you just look at your family member or look at somebody at the restaurant. What they're doing, they're cutting the steak, the potato, the cream cheese potato thing, they're putting it in their mouth, they're chewing it, and they're getting ready for the next bite. Or if it's a spoon, they shovel the rice and curry in and they're shoveling the next thing. There is no break in the mouth between food going in and chewing. What you have to learn to do is put that bite in your mouth, chew your food, enjoy it, because that's the only place where you can have taste. There's no taste buds after the food goes down your throat. So enjoy the food, put your fork down, put your spoon down. When you have finished chewing and enjoying that, then you pick up your fork or your spoon, and then you load up for the next meal. I tell you, it is extremely difficult. You will have to do a lot of effort to train yourself, but it is extremely beneficial to just do that. So when you eat with people, you don't eat alone. You know, they say the prophet never ate alone, or he always ate with people. You know, I'm not sure that hadith is true or what the details are. But the point is, you socialize when you eat. When you socialize, you talk and you wait. So you're not eating as fast, you're taking a longer time. As for sequentially, you go to a buffet, don't load your plate with all the food that is there. The biryani and the samosa and the salad and the beans and everything in this one plate. Or like at a Chinese food thing, you're putting all. Don't do that. Go to the buffet, pick the healthy food first. So the salad or the legumes or some baked good or fish or whatever. And then you go back and pick the next thing. And then what you really want to eat, that biryani or the samosa or whatever, you go keep an eye on it, and you're going to go third time or the fourth time, and that's when you're going to take it. So when you eat sequentially, I guarantee you by the end of it, you're going to eat much less biryani. And sometimes you won't even eat the samosa because you say, okay, I'm full, I don't need it. And therefore you learn to eat healthy and you don't eat so much of the unhealthy. It's about sequential eating. Don't pile all the food together of all kinds into your plate. Supper. If you eat latest by 6 or 7 p.m., and there's a lot of science in it, then you don't harm yourself as much with the same food if you ate it at 9 or 10 o'clock at night. So it's the same food, but if you eat it earlier in the evening, and there's a circadian pattern, hormonal science behind it, and so there is enough evidence. The key is don't eat late at night. Now, you say, oh, I eat at 6 or 5 o'clock, then I feel hungry again before I go to bed. Yes, have a snack, have some fruit, mix it with a little bit of yogurt ice cream, have some nuts, almonds and walnuts and stuff. And then you go to bed. You have done everything healthy and you've added protection to your system. Separate the dessert from your meal. What we do is we have a meal, we're sitting at the table, and then the dessert comes and we continue to eat. Don't do that in your home or where you go out or whatever. Separate the dessert from your meal. Finish eating, have your dessert later, and more than often you're going to eat less dessert, or you may even decide to forego it because you then don't really have that zeal, because by that time the food has gone through the satiety center, all the glucose metabolism and insulin surges are all finished, and you no longer are hungry, and you may not eat that dessert at all if you separate it. Small meals. You eat a large meal, you dilate your stomach, and then you need to eat more and more each time. If you eat smaller meals, your stomach contracts, and over time, you're going to get full with smaller meals. The stomach can enlarge to a very large level or to contract to a very small amount. And it is all about how much food you put into it at one time. And then you go to learn how to cook your food, bake, broil, boil, barbecue, and avoid frying. So this is about how to eat and when to eat. So then you say, well, I want to do a little bit further and I want to know what to eat and what not to eat. And I've gone over that with you. It's all about the white stuff, the sugar in the sugary drinks or in baked goods, you know. But if fruits have fructose in it, not sucrose, and even if you are diabetic, there is no harm from eating as much fruit as you want to eat. All right. Starch, rice, bread, potatoes, pasta, noodles, rice, bread, potatoes, pasta, noodles. Avoid the white stuff, the processed flour. One molecule of that makes 6 molecules of glucose in your body. And then when you want to choose your food, I've taught you, it's about color and speed. And that helps you, speed helps you pick the meats and the poultry and the seafood. Color helps you pick the vegetables, fruits, and the legumes and the nuts. Sedentary, S for sedentary. You don't want to be sitting around. Your body, half of your body has all the organs in it. All your organs are in the upper half of your body. The lower half of your body, Allah has given you a full half of your body only for activity, legs. So he's giving you a message that half your body is there to do something, to keep you active and moving. So you should not be sitting for more than half an hour to 1 hour. Long periods of sitting are worse than smoking, worse than high blood pressure. So you need to stand up, pace around. When you get a phone call, get up, walk around. When you're watching sports, walk around the room, be standing, or stationary bike. Keep active, include activity into your daily living so that you park a little bit farther from the door of the mall or the shop you're going to. You get a good parking spot, nobody's going to knock your car door, you get the 200 meters of walking and get everything done. So it's about, including activity to incorporate it into your daily living. So it doesn't matter what activity you do, as long as you move and as long as you are active, and you can do it in different ways. Here is, Fatma Kanu and Nurubai, and they are doing the Bollywood Macarena. It works. There is no problem. This is what everybody should be doing. So this is almost the last slide. And what is on this slide should be tattooed on your forehead. It should be tattooed on your forearms. It should be pasted on every mirror in your house. It should be on every door in your house. It should be on the fridge. It should be on the dash of your car, everywhere. What this is the secret of the S program, all in one spot. No smoking, S. Don't be sedentary, sitting, bad, move. S for eating slowly and sequentially. Avoid the white stuff, sugars and starches, and remember the hidden sugar in different things. Use speed and color to pick the foods you want. Social, remain with your relationships. Work to be happy. Learn to silence your mind and nurture your soul, and try to avoid stress, which has emotional pain attached with it. And if you do this and you follow this program, you will have mastered the secret of successful, long-term, happy survival. So the very first Farman Hazri Imam made in Mombasa. So I'm still working on all those initial Farmans. He said, before I conclude, I would like you to remember that prayer for the soul. So nourish your spiritual part. Exercise for the body. Take care of your physical body with activity. And goodwill and cooperation in your mind. So relationships, getting along with people, having that nurture of your mate, support system, you will always succeed. So this is it. It's about body, mind, and soul. And I've shown you through the Secret S program how you can achieve that. So, he went on to say, I have seen in my Jamaat illnesses which have no reason to be, which are irrevocable, and which I do not wish to see anymore in my Jamaat. In other words, apply preventive medicine before the curative becomes necessary. So it's all about prevention. And what do I say? I say, the more I understand science and medicine, the more I think I understand and appreciate God and his amazing creation, Ashraful Makhlukat. Thank you.
Thank you, Dr. Abdullah. That was a very inspiring talk. Second time I've seen a lot of the talk and I'm still inspired.